we're going to get started. Thank you very much first to our panelists for whom you will hear from. And also thanks to Niehoff School of Nursing, Career Services, and Parkinson's. We all came together to put together this event for you all so that you could hear from various employers in the healthcare field. So I'm Dr. Cynthia Stewart. I'm the Director of Experiential Learning for Parkinson School of Health Science and Public Health. So we're going to get started with a couple of brief introductions from each of the panelists. And then after that, I'll be moderating questions to each of the panelists that can answer those questions. If you have any questions that you may have for a particular panelist or any of the panelists, please feel free to use the chat function. Meg Seberg from Career Services is monitoring that chat, and we'll be able to answer your questions as they come in. But you could also, towards the end, we'll do some Q&A towards the last 15 minutes, and feel free if you'd like to save your questions, and you could ask direct questions around that time. So in order to get started, so our panelists are Dr. Andrew Wang. He's the Population Health Director from Lawndale Christian Health Center. We also have Erin Falsey, the Pediatric Genetic Counselor, University of Illinois Health. We have Jermaine Johnson, who is the CEO of Transform Fitness Chicago. And then we also have Joanne Whiteside, Healthcare 101 Inc., founder and nurse coach, and she also works for Loyola Niehoff School of Medicine. So I would like them to give a short introduction of who they are, pretty much kind of said a little bit about where they work, but talk about your position and what your day-to-day work looks like. So if we could please start with Dr. Wang.
Hi, everyone. It's a pleasure to be here. Thank you, Dr. Stewart, for the wonderful introductions. And it's just a pleasure to meet all the fellow panelists here. We're doing a lot of important work in the healthcare field and very grateful to share a little bit about the important work that I'm doing at Lawndale Christian Health Center. And I'll keep this brief. My role as Population Health Director is responsible for supporting and taking care of different population groups. I'm also the Health Equity Champion for our organization. Lawndale Christian Health Center is a federally qualified health center. We serve around 60 to 80,000 patients located in the west side of Chicago. You may have heard of the neighborhoods of North Lawndale, South Lawndale, and Little Village. We primarily focus on supporting patients who are uninsured or patients with Medicaid, and we have a large population of individuals who are persons of color. So happy to support and share with you all the important work that we do and what do we do on a day-to-day basis. What do I do on a day-to-day basis? I work with multiple teams from our providers, including our physicians, our advanced practicing providers, which include nurse, certified nurse practitioners and physician assistants, and as well as our multifaceted, multidisciplinary care teams that care for patients on a day-to-day basis. And so really happy to be here. And, I focus a lot on the data side of things, but I also try to champion a lot of the important health disparities and how do we reduce health disparities. So glad to share with you all. And Erin, please go ahead.
Thank you, Andrew. So as Dr. Stewart had said, I work as a pediatric genetic counselor at the University of Illinois Hospital. I have a mix of in-person patient-facing days in the clinic, as well as some administrative days during my week. During the days that I'm with patients, I'll do a medical intake, take a family history, talk about genetic testing and what the test could potentially detect that we're ordering. And then on my administrative days, I do a lot of note writing, placing orders, some not so fun stuff like prior authorizations with insurance, and also calling out results to patients. And I also work with the traditionally underserved community and a high Medicaid population as well.
Jermaine, please feel free.
Go ahead.
Please feel free to share.
Hi, good afternoon. Oh, good afternoon now. My name is Jermaine Johnson. I'm owner of Transform Fit Club. I graduated from SUNY Brockport State in New York with a undergrad in business management. And I'm a strength coach. I have a mix of I'm a strength coach, personal trainer, group fitness coach, and I manage this club with, we have like 8 different independent trainers and therapists. We have movement physical therapy here at the club. So the day-to-day here is managing these trainers, managing our physical therapist that runs his business here. And he also has 4 other locations. So managing those guys, managing our marketing. We have a big marketing campaign going on right now. We have our gym of 150 members. We've been open for 2 years now. We opened dead center in the pandemic. Things are going well despite opening during the pandemic. And we're in West Loop, Chicago. And day to day, we work with a ton of personal weight loss clients. We work with a lot of that. And then we have segments throughout the day where we work with a lot of athletes, especially basketball players and volleyball players. So dealing with them, athlete training, and also injuries, dealing with the sports injuries, dealing with chronic stuff that we get from a lot of patients. We get patients through movement, physical therapy. So managing a lot of that stuff. And as a new business, everything, a lot of challenges, which we could dive in more, but I'll be brief today. I'll be brief for this segment right now talking. And that's just some of the stuff, that we do day to day.
Thank you.
And I'll turn it, yes, thank you.
I get what you're saying. Joanne, please.
Okay, hello everybody. Welcome. My name is Joanne Whiteside. I am an alumni of Loyola University from the School of Nursing class of 1994, and I've spent the last 30 years as a bedside nurse in high-risk labor and delivery, ER trauma, and the last 15 years as an immediate care nurse in the community out in the western suburbs. Working through the pandemic as a frontline COVID nurse, I decided to change the trajectory of my career, and I advanced my career to become a board certified nurse coach, which is a specialty through the American Holistic Nurses Association. So I'd say to my nursing students or anybody taking psychology, pay close attention, because what a nurse coach does is we work with people to change their mindset to live a lifestyle of health and well-being. So I started a company called Healthcare 101 because I couldn't stand to keep working with clients or patients in the hospital that weren't getting any better and just putting very expensive Band-Aids on patients. So I stepped away from the bedside, found an organization of nurse coaches who train nurses to become board certified nurse coaches. I did that last year. It was a 7-month training program that I started during the pandemic. It was all done online, but I met 200 other people who are doing the same exact thing. We were all ER, ICU, seasoned registered nurses who decided to take our knowledge and experience to a different place for our clients. So Healthcare 101 was formed last year. So I became an entrepreneur, formed my own company. It is a telehealth service that I offer. And so I do work from home. I have 3 small children. And in fact, I'm home today with a sick child and I am able to see clients through telehealth. I use HIPAA compliant software to allow me to do Zoom meetings with my clients and take my notes. And what I do is I spend 6 to 9 months meeting with my clients on a weekly basis for about an hour at a time. And not only go through what their medical history is, but get to the root cause of why they are not reaching their health goals. And it is very often not seen in the medical record as to why people don't reach their health goals. And a lot of it is mindset. And I work with people to set very small weekly goals to transform their lifestyles. I do follow the direction of the American College of Lifestyle Medicine, which expects a plant-based or plant-forward nutrition, frequent exercise, sleep hygiene, mindfulness, meditation, personal, social relationships. I do all of that in my personal life, and then I train clients to reach those in their lives. And it's different than the way the normal healthcare system is set up. I don't make diagnoses. I invite patients to describe what goals they want to reach, and then I help them reach those goals. My day-to-day life is mostly marketing and sales, because as an entrepreneur, I am the sole owner of this business. So I have my administrative days and then the days that I see clients. I love it because I get to set up my own hours. And that is really important for me as a working parent. And it allows me to see my clients when it's convenient for both of us, rather than being at work in the middle of the night or at 6:30 in the morning. And it's been a wonderful way to treat people differently than the traditional healthcare services. But my day-to-day life is now in front of a computer, which is not how it is in the hospital usually. But I love the freedom and accountability that I have as an entrepreneur. And I'm also a faculty member in the School of Nursing. I teach OB simulation and team health steps.
Okay, thank you very much for those introductions. And students, as you can see, we wanted to give you a wide variety of individuals that are working either in a hospital setting, those who are in exercise science, someone who started their own fit club in the West Loop, as well as someone also who is a faculty member, but also is an entrepreneur as well. So we wanted to be able to let you hear from a variety of, different individuals. You have Dr. Wang, who's in the community and actually working with an FQHC. So panelists, so have a question just in regards to what led you to work in the field that you're particularly in. And can you also share what was helpful for you to prepare to be in the position that you're in right now?
Thank you, Dr. Stewart. Yeah, for my field of work, I've always been interested in healthcare. As a kid, I always looked up to those who served in the healthcare setting or devoted their lives to healthcare. It's quite the humbling career. It may be there may be a variety of roles in that field, and exploring and understanding those roles is really important. And for myself, ultimately, what I did was I shadowed different careers in the healthcare setting, and that has led me to ultimately decide to go into the field of public health. I was somewhat interested in doing clinical medicine, like individual patient care, but after learning about public health and ultimately working in the field of population health, I was really excited for being able to support many populations. So not necessarily just one individual patient or a panel of patients, but potentially thousands and tens of thousands or hundreds of thousands of patients or individuals or populations. And so that was probably my ultimate reason why I went into public health, because I really cared about how different public health policies influence and affect and ultimately benefit various populations and their health. And secondly, public health has always been really close to my heart because I think it's affected so many individuals. And some people like to work with data, and public health is probably one of those fields where you get to work with data and with patients as well, especially in the community-based settings, such as a federally qualified health center. I've worked in a variety of academic health centers previously to Lawndale Christian Health Center, all in sort of fields of public health. And so public health has a lot of different domains. I'm sure many of your students are aware of that. My domain began in health policy and management, working in the hospital setting, working in hospital management, and then ultimately focusing on reducing health disparities. What would I recommend as being the most helpful thing that's prepared me for my work? Well, I would say that being able to speak with individuals like those here on this panel is probably one of the most helpful things that I found that has helped me prepare for my field, because everyone has different expertise, and leaning on individuals like my colleagues here on this panel really helped me understand what do people deal with, and what do they need, and how do we support and serve them in their healthcare needs? Everyone comes from a different background, different context, and it's important to keep that in mind in the field of public health and medicine. So, being able to be a part of this event when I was younger, when I was a student as well, is probably something that's helped me better gauge. And then ultimately shadowing individuals, having mentors is really important. That has helped me prepare for the work. And then lastly, having different types of experiences and a variety of educational experiences is really important. From a master's of public health that I have in healthcare management to a PhD in public health, focus on health services research and health disparities probably has helped me really tie all that in together. But ultimately, working with the different individuals is what has been most helpful to me. So glad to share about those experiences. Erin?
Yes, so I definitely agree with Dr. Wang that what's been most helpful in preparing me for my role is really the experiences outside of the classroom, especially in graduate school, just putting myself out of my comfort zone. I'm definitely very comfortable in the classroom. I can write papers, I can take tests, but when it comes to actually, sitting in the role of a genetic counselor and doing that as a student, that's what really prepared me the most. And then as far as what led me to this career, it was definitely an interest in genetics and wanting to have a patient-facing role. Not so much like an interest in public health, although there definitely is some overlap between genetics and public health, which is a field called preventive genomics. And I'm definitely happy to speak with anyone more about that in depth. I think it would take, a little longer than the time I have on this panel, but if anyone's interested in learning more about that, you can definitely reach out to me.
Oh, I'm sorry. Okay, just to add to that, what led me into this field, I would say for me, it was more so, I was a former college athlete playing basketball, and I always loved exercise, and I love to prepare. I love the process of training for games. So that helped me in terms of, being fitness and being into that. But in college, when I first got there, I was a physical education major. Loved the curriculum. But 2 years in, I realized I didn't want to be a gym teacher. So I didn't know what I wanted to do. So I just picked business management because it was broad, and I knew some capacity I wanted to have my own business in the future. So that, when I finished playing, we also going to a small college, a Division III college. We didn't. Our strength coach was also the head baseball coach, and he also had 5 other sports that he worked for, that he coached for. So we didn't really have too much to work with as far as programming, and that's where I, kind of like made an own role for myself, being the strength coach. So my role, as when I was done playing, was I was a grad assistant, and my role was player development. And then that's kind of sparked me wanting to train. And fast forward to finishing college, I had a best friend that was really, one of the best trainers in the world. And he moved here in Chicago. I visited the city and seeing how he was training, having his own business, being a fitness trainer, not just for athletes, but he, worked predominantly with Gen Pop, but he made a name for himself in that. And I kind of followed him, so he was kind of a mentor for me. So that kind of helped. So getting a mentor is huge. And then just learning, when I first got here, 8 years ago, it was more just, no sleep, no social life. It was, training 40, 50 sessions a week, and just learning, getting experience, getting your reps in, but also, staying in tune with the latest trends as far as certifications, and just soaking all of it in, and which has helped me to get to the point where I'm today. But initially, I didn't want to be a gym owner. It kind of fell in my lap because I was, when I started here, I was mostly training Gen Pop, but then about 5 years ago, I started working with the Whitney Young varsity basketball team. And then once I started working with them, I just got too busy with, people and the right opportunity with my client and current business partner, like opened up as far as to have a facility. And I jumped straight in because I couldn't train, everyone. So I'm like, all right, we can get a facility, we can get trainers, and we can grow a business here. And the relationships is crucial, right? So like part of, learning, I met a really, really good physical therapist. Name is Dr. Sam Shaw, just soaking everything up. Any client I had with them with ailments, I would send them to him. And then I would also sit in on those actual sessions because I just wanted to learn how he trained and how he treated. So that relationship ended up turning into a partnership where now he's actually a partner of mine. And that goes hand in hand with having a facility and managing 150 plus members and 7 different independent trainers. And that's kind of got where I'm at now. So I would say biggest thing is relationships. Mentorship is huge. Ask questions because I had a lot of help, and experience. You're not going to be good right off the bat. Experience, and it takes time. Just love the process, fall in the process. It's not fun, but after a while of putting in that work, you start to see a lot of benefits and stuff like that. And then it helps so that I do love to serve people because I love doing it. That's half the battle, and part of one of my our missions here is to help people no matter what. And some of our core values is to serve, great service, kindness, different things of going over and beyond for clients and stuff like that. So just make a long story longer. That's pretty much it for that set.
Okay, am I the last one then? Okay, so what led me here? I always knew that I wanted to care for sick people. It was a great interest of mine as a child. I thought I was going to go to medical school, but because I'm one of 9 children, the financial implications of that kind of was my blocking. So I chose nursing. I'm so glad I did because there are so many options available with nursing. I love pathophysiology and pharmacology. And so I took a great interest in obstetrics and became a labor and delivery nurse when I graduated from Loyola and I worked at the Loyola Medical Center as a labor and delivery nurse on the night shift for 6 years. And there I really, really learned what I was capable of, to be 21 years old and taking care of women who are trying to die during childbirth, babies who are trying to die at birth, taking care of women with incredibly complex obstetrical histories and learning how to care for them and serve them. I learned a lot about myself and teamwork and loved it, absolutely loved it. And that's why I still teach obstetrics, but did get burned out and then went from the frying pan into the fire and decided to go become an ER nurse at Northwestern and do ER trauma. And that's, again, I like a challenge. I worked the night shift to be working in the night shift on a weekend at Northwestern in the 2000s was very, very interesting. That's when club drugs were coming out. And boy, one of the things that you learn taking care of people is the vastness of humanity and stepping out of your comfort zone and your capabilities. And so I stayed in healthcare at the bedside. And because my husband got a job out in Naperville, so I moved to Naperville, worked as an immediate care nurse. As my family was growing, I needed something that wasn't as exhausting as ER nursing. And so I spent 15 years working in the communities as an immediate care nurse in the Naperville, Bolingbrook, Oswego area. And through that time, I came to see that there was we were never addressing the root cause of why everybody was getting sicker and sicker. Despite all of our advances in healthcare, my community members were getting more and more medications prescribed, more and more disease processes diagnosed. And I was watching, it's like watching a slow train wreck happening in front of you. And the COVID pandemic actually was one of the best things that could have happened to my career, because I survived, nothing happened to me during the COVID pandemic. My whole family survived it well. It brought to light that I didn't want to keep working, taking care of people in a capacity that I felt powerless in anymore. And I did not know what I was looking for until I started searching for another way to be a nurse. And I found a community of nurses who are doing exactly what I'm doing now. I learned that there was another way to serve my patients that was not in the acute care setting. And I didn't know that as a nurse, I could be in private practice without being a nurse practitioner. And I considered becoming a nurse practitioner, but I realized I did not want to learn just how to prescribe more medications. And so when I found this community of nurse coaches and learned what it was, it spoke to me. This is when I really learned about things speaking to your heart. It all came to alignment then. It was, I have so much to offer to my patients, and I wasn't feeling in alignment with the way I was serving them in the healthcare system. And so I found people who were doing it a different way. And now I own my own practice and I serve people in a different way. And I think Coach Jermaine talked about serving people. And that was a huge message from Loyola's education, is serving our community. And I decided to serve people in a different way. And when I take care of clients through coaching, they get these aha moments that bring chills to me. I mean, just to see a client like have this, oh my God, I never thought of it that way. I never saw things that way. And they break through their own barriers to start exercising or to change their eating habits, which have been ingrained since birth. It is an amazing way. And to touch on Dr. Wang, working as an immediate care nurse, I am integrated into the community, and population health is a huge part of what we do. And I was seeing that it didn't matter what our policies were or what things we offered, people just weren't changing their lifestyles. And I realized it had to come from within. And so I teach my clients to take absolute personal responsibility for every single decision that they make, every single food morsel they put in their mouth, every single thing they drink, what they listen to, how they move their bodies when they go to sleep. We talk about absolute personal responsibility for their health and well-being, what that means for mind, body, and soul. And we get into a lot of soul work, a lot of deep spiritual soul work, to get people to realize how they can show up for themselves and love themselves enough to take care of themselves. And this is a huge, huge thing for a lot of people. Where I live in the Naperville community, we are a very well-resourced community economically and educationally. And yet I saw a degradation of health because we have so many fast food restaurants and so much free ability to eat and drink whatever the hell you want, and seeing how it was devastating people's health. And so I don't get clients through the traditional healthcare system. I invite them if they're ready to change. People are only ready to change when they want to. I cannot tell people how to change their lives. They have to want to, and then I'm their guide to remodeling their lifestyle. But it came through taking care of the sickest of the sick. And then after years of doing it, I realized we got to stop the train wreck before it happens. And so I dedicated my professional life to meeting people wherever they are. And we talk about health equity. I meet people wherever they are, because that's all you can do, and find out what their barriers are to them leading their healthiest life. And then we figure out how to overcome those barriers. Most of my clients, their barriers are they've built in their own head. They've decided they can't do something because of their age or their lifestyle or whatever. And one of the things that I have personally, because that's how most of my clients come, is they meet me personally. I am a 50-year-old woman who has 3 children in elementary school. I went through a decade of infertility treatments. I was born with a congenital heart problem that I have an enormous exercise intolerance, and yet I'm at the gym every day. I show people how I was able to change my lifestyle despite having an inborn genetic health disparity that impacted my heart and my fertility, and did it all well and stayed healthy. And that I've become an inspiration to people also how to balance a work-life balance with children and a busy career. And so that is what got me most of my clients. Is actually most of my clients have been people who are middle-aged people who are trying to prevent getting sick and in the hospital. And I tell people, let's meet before you end up in the ER or the ICU, and let's change those lifestyles. And so when people meet me and they kind of hear my story, then they're like, oh, okay, yeah, we need to work together. And I bring them in as clients. And that is how I'm serving my patients now.
Thank you all so much for sharing. Can you all talk a little bit? We heard about mentorship, about shadowing, about bringing experience. Can you talk a little bit about what challenges have you experienced in the various fields that you're working in? But then also on the flip side of that, what do you like best about what you do in your field?
Yeah, happy to share and start here. Serving a population who largely are uninsured, low income, facing significant health disparities has been certainly very challenging. I've worked in the health policy field for over 15 years, trying to better resource and support populations that are suffering from the worst health outcomes, from with individuals with all backgrounds, race, ethnicity, culture, income. And serving those populations can be challenging because they are already at such a large disadvantage. But with that, there's so much opportunity. And the best part is seeing patients either on the individual basis or on the population basis really improve in their health outcomes. Seeing individuals who may not necessarily have the opportunity to address food deserts, individuals who face living in areas with food deserts, or individuals who may be challenged with what Joanne was sharing. They have their own personal barriers. Healthcare is finally heading towards a direction of a bi-directional approach to support our patients. We have a wonderful program called the Self-Monitoring Blood Pressure Program that we're having over 2,000 patients involved in this program. This is exactly what we are thinking about in terms of a bi-directional support for patients. So before, our doctors, our nurse practitioners, or physician assistants, they would work with the patient and be like, here, your blood pressure is really terrible. Take these medications, do these things, and hopefully your blood pressure improves. Now we're empowering our patients with that knowledge and information so that they can act on how do they overcome high blood pressure and hypertension. And as Joanne was sharing a little bit earlier, we're able to achieve that, or able to surpass that barrier, because we're able to work with them on an individual basis. What are the mental challenges that they're facing with dealing with high blood pressure? You know, there's a lot of fast food restaurants that are easy to get to, and I don't want to make them the enemy here, but they are certainly a challenge. It's easy access to food. You know, it's affordable, it's inexpensive. You feel full after spending very little, but ultimately it does not benefit their health at the end of the day, especially if they are accessing fast food on a daily basis. So working with them and getting to where they are, meeting them where they are, that's important. We have conversations with our patients to understand, are there ways that they can, have better things to eat? We have a place called the Farm on Ogden, located just 2 blocks down the road from my healthcare center. And that provides very affordable fruits and vegetables to our neighbors, our communities. And then we have cooking demonstration classes, because not everyone is an excellent cook or chef. Not everyone can make the best meals, because it's hard, it's not easy. And so we provide these classes so that we can show to our community that there are ways to make affordable and delicious meals and quickly too, and without too much cost, because those are two barriers: lack of financial resources, and also second time. A lot of our populations work multiple jobs. You know, you don't have an hour or two if you're taking care of your children, your grandchildren, or your neighbors' children, because they're facing so much violence in the community or other barriers or financial challenges. So I think that's been the best part of the work that we do, that we're able to meet our patients where they are at, and ultimately prevent death, and eventually also help their health overall. So thank you.
Witnessing a lack of resources is definitely something that's difficult about my job as well. One of the common reasons that I see patients for are developmental delays in children, and it's been really difficult to see children who are really in need of therapies not be able to receive them, and ultimately just being set back even further at a time where it is really critical to have access to these resources. And on the flip side, I do really enjoy being able to advocate for my patients. That's one of the best parts of my job. I'm constantly writing letters to schools. I'll never turn a patient down, no matter what they ask me for help with. If they want help signing up for Social Security, I'll look into it. If they need FMLA paperwork signed, I'll fill it out. I never tell somebody no. I really love advocating for my patients. And then another part of genetics is just, it's never boring. I'm constantly discovering new diagnoses in my patients that I've never heard of before. So I'm always teaching myself, always looking stuff up. And then the field is just progressing so rapidly. The tests are getting so much better. And so it really keeps me on my toes as well, as far as continuing education.
I would say some of the biggest challenges as a personal trainer would be more like, to add on to what Joanne's saying, holding people accountable and, kind of empowering them to have responsibility on their own, because we built enough rapport and experience and education where we can literally make a client have the best exercise possible. Right. But we only have them 2 to 3 sessions a week on average. So that's 2 to 3 hours. But the other 158 hours of the week is more important. So hold accountability with that. And then as a business owner, just the challenges is of opening a business, learning about coding, learning about where things go. I know this space is brand new. We had to get certain things redone, which was very expensive. Like we had an elevator put in, which was really expensive. We've had different, we had to wall certain areas where it didn't make code, like as far as wheelchair accessibility. Different things like that was really stressful getting through. And then just as a business owner, the accounting aspect, even though I graduated a management degree, having a good accountant and staying on top of your financials literally every day, looking at your financial report is crucial. Staying on top of, money coming in, money coming out, because right now there's a lot of expenses. We're still early in the game, so we're still utilizing a lot of our revenues, spending on marketing, spending on campaigns, investing in equipment, because that's ongoing. So equipment and flooring and then just different adjustments for that, and then just having that will, because I am training people, but also I got to wear a cap of managing people and being a business owner and stuff like that, and setting the culture, which I know, we'll get into later about culture, but it's important, and I just some of that stuff. Hopefully that's helpful.
Dr. Stewart, can you send the question? I forgot at this point, I've forgotten what the question was.
Oh, no worries. So it was in regards to any challenges that you have faced working in a particular field that you're in, and then what's one thing that you like the best about the field that you're in?
So one of my biggest challenges, as an entrepreneur, is you have to do all your own marketing and sales and get your, it's building from the ground up. For me as a nurse, I joke that, when you are a nurse or a doctor, or like you work in healthcare, as long as people eat, drink alcohol, and have sex, we could just sit back and have our departments filled. Like you didn't have to do anything. People just showed up. And there was a beauty to that I took pride in the fact that I didn't have to sell myself. My services were there and people showed up, and that happened. So one of the biggest challenges is moving into the role as an entrepreneur, because being trained as a nurse and working as a nurse, we're not trained in the business aspect of things, the psychology of sales. Now, when I go into it, yes, as a nurse, you do a tremendous amount of psychology with your client, with your patients. We sell things all the time when we try to convince our patients to do things and go along with the treatment plan. But it's different because now there's money involved and you're asking people to agree to sign a contract and spend a lot of money and time and things like that. So one of my biggest challenges was finding the support system for what I embarked on. And I came to love knowing that there is a network of people that I am now part of that I wasn't part of before, and we're all supporting each other through what we're doing. It's a group of entrepreneurs doing the same thing. I also learned the importance of investing in a coach. I had never heard of a coach. I mean, I've heard of like baseball coaches, sports coaches. I have never, growing up, no, I didn't know anybody who went to a coach. Learning about what coaches do and their capacity to help you grow as a human being. I saw that. I had to do it as part of my training. I had to be coached as well as coach another peer to grow into this capacity. Now I hire my own coaches. I have a business coach. I've had nurse coaches. Now I'm all about, oh my gosh, if I have a goal I want to meet, I find somebody who's done it and works as a coach and does it. And so that's what I have done. But the challenge was finding my tribe and continuously being involved with them when we step out of our comfort zones in anything we do. So for me, it was first in the clinical setting. I went from being a labor and delivery nurse to an ER nurse. I was stepping out of my comfort zone into a different clinical realm, letting people know I'm new, I'm learning, help me, finding your preceptors or your mentors. So the same thing in business, I had to find people that were willing to help a struggling newbie. Nothing like being a 30-year experienced healthcare provider and then stepping into a brand new role and feeling like a complete novice. And as Jermaine said, it is marketing, it is finance, it is learning how to run a business, which is it uses a different part of the brain. And my husband had to remind me, remember what you were doing with sick people. That is so much more complex than what you're doing now, but it uses a different part of the brain. So a very important part, and what I love now, is having my own business coach who I meet with weekly, and he keeps me in line. He keeps me focused. Otherwise, I would get lost in the vortex of my life with children and work and outside work. And my husband's an ER physician, so his job is very, very busy too. And like that, how do I make dinner? Who's doing this today? We got a COVID puppy. So I have a 2-year-old dog who also needs to be attended to, and balancing all that without losing myself in it. One of the things I love about what I do now is I am expected to live this lifestyle. I am expected, if I am going to be a health and wellness coach, I have to walk the walk and talk the talk. I eat and cook a plant-based diet. My whole family does. I transitioned my family of 5 from a healthy traditional American diet to a complete plant-based diet. And that was about 5 years ago. And I love it. It was the best thing we ever did, but it took about a year to transition. So I've done that. I do time management, but I have to do it. So it holds me accountable. I have to put myself first. That's one of the biggest things that I learned in this journey that I went on. We are often taught to care for others. We serve others. the message that we don't get out is you have to care for yourself first. You have to fill your cup first. No one asks you to give up your health and well-being in the care of others. And that had happened so much in the healthcare system. We see healthcare providers who are exhausted and completely gave up their health and well-being in the care of patients. And I am trying to bring them back in line with their own self-care. And that's a real mind struggle for a lot of people, to do self-personal care before they can care for others. And I do that. I find that my responsibility as a registered nurse on that whole population health and public health measure is, as a nurse, I have a personal responsibility to show my community how to live a healthy life. And I do it consistently and throughout my days. So I lead by example. I believe that's the best way to do that. It wasn't hard for me when I saw the root cause of so much disease. It's the lifestyle we lead. About 80% of what we see in healthcare is the lifestyle that we lead. I do talk about epigenetics. So Erin, I do talk about how we have genes that can be turned on and off depending on what we're exposed to and what we do with ourselves. So that's a new thing. I talk about phytonutrients and epigenetics and things like that, and switching people's mindsets. But I had to learn to do it all myself and lead by example and find a network of supporters who want to see entrepreneurs and healthcare entrepreneurs thrive. And I have to stay engrossed in that. Otherwise you lose yourself in the vortex of life. And then through that, I am able to serve my patients and clients better because I am a stable, healthy person.
Okay, thank you very much. Students, if you have any questions, please, you can put them in the chat as I ask this last question of any of the panelists that would like to give students, what strategies would you give them? We have the career fair that's going to happen on next Wednesday. What advice or what strategies would you give students as they get ready to prepare to apply for positions in any one of your fields, any one word or advice? And students, please feel free to put questions in the chat, please.
Dr. Stewart, would you say this is a general conversation surrounding strategies for any of the panelists?
Yes, for any of the panelists, if you would like to share, just strategies, helpful things for students to prepare as they get ready to go out into the workforce. Many of our students they're undergraduates. We may have a couple of graduate students that are on here. So any advice or strategies that you would give them?
I'm happy to start, and if there's others that want to jump in, I think working in healthcare, there's just a variety of roles, and at our federally qualified health center, we have in hospital systems as well. We have individuals like Erin, we have individuals like Coach Jermaine, and then individuals like Joanne here who have a variety of really different types of roles. Like we have a health and fitness center actually as part of our federally qualified health center. And our coaches or our wellness staff are so important because they really support patients who are struggling with being able to incorporate exercise and exercise science and exercise medicine into their lives. And so there's so many different roles to think about. And I think a key strategy that I thought of when I was in undergraduate or when I was in graduate school is, especially at these fairs, is to have meaningful conversations. You may not have that much time with individuals at these fairs, but get to know them, get to find out about their careers, what they do. If they are more so related to the HR side of things, ask for individuals that you could connect with actually at their organizations, people who are willing to speak with them. And then see if there are opportunities that are potentially internships that you could do over the summer or for a year between after college and either your next degree or other career pursuits. I think it's important to have a variety of experiences, and those experiences demonstrate to potential employers, that you are eager and excited to learn about different things and that you're able to adapt and you've had a variety. I think that's what's helped me a lot with my career, is that I've shown potential employers that I have a wide variety of workplaces of experience, from either large academic health centers to the federal government, to smaller healthcare facilities, to the working for the government level, the state government level on health policy. So that's really helped me with me when I was a student, and I appreciate and look forward to what my other panelists recommend for strategies.
Can I jump in after Andrew? One of the, I agree about asking, showing up, speaking. So when I talk to my students now, in the School of Nursing, students do a clinical role transition. This is like the last full-time clinical rotation you do at the end of your senior year of nursing school, where you shadow with another nurse on their schedule and do everything they do. And oftentimes students are like, I want to be in the ICU, or I want to be in the ER, these areas that they don't traditionally hire new students. I say, tell everybody what you want to do, share that, let people know so that they can help you, ask to do things. People want to help students or young people at the beginning of their careers. They want that. And one of the things I loved about my education as a Loyola student myself was it did set me up for the confidence to show up in the world, that you are held to a level of expectation of be a leader, know how to communicate effectively. And employers want to see that. Are you, did you show up on time and a little bit early for your appointments? Do you speak clearly and meet people face to face, or, well? We teach our nursing students how to do telehealth visits because there is a different bit of communication when you're telehealthing versus in person. But it's that idea of personal responsibility, networking, and asking for things. And as I've learned as an entrepreneur, if you don't ask for it, you can't get it. So learning how to step out of your comfort zone, that was not my strong suit as a student, because in healthcare, in the health sciences, it's very much, this is how you do things, and you don't waver from that. We don't go into the hospital and say, well, let me try something new today and see what works for treating this client. You follow protocols. So that was very, very challenging for me as a nurse, to step out of that and become a creative in the healthcare, in the entrepreneurial arena. You have to be creative. But as a student, I would say, and I talk to adults about this too, because there are a lot of middle-aged people who are like, I just don't know what I want to do when I grow up, and I don't know how to move and change and all that. We have these same discussions with 55-year-old people. I ask people to quiet their minds. So I make all of my clients meditate, because that's one of the ways to quiet the brain, and ask them what really interests you. And one of the exercises I do with people is, if you were sitting in a waiting room somewhere and there were magazines all over the counter, there was fishing and home decor and Italian cooking and photography and whatever, all these magazines, which three would you pick up that you found interesting? And that makes people go, And then I ask why. What about it is interesting? How do you want to use this in your life? How do you want to serve people? What is of interest to you? And then figuring out other people who are doing that job, and then figure out how they got there. So I knew that I wanted to work in OB when I was a student, and I told everybody, I told my clinical instructors. So when I did my OB rotation, I told my preceptors, I want to do this. How can I do this? And because of my education at Loyola, I was hired as a new grad in labor and delivery at their medical center, which they didn't do before that. They hired 3 new grads in labor and delivery as a new thing, and all 3 of us were Loyola graduates. I believe that the education that Loyola provides, if you pay attention, if you show up and you pay attention and you put in what you want to get out, you will be set for whatever you want to do. And I have learned that life, as in anything, you get out what you put in. Don't be afraid to challenge your comfort zone. I got very comfortable for a very long time and thought this is the way it should be. And then I got stagnant and learned I had to step out of my comfort zone. That is a scary, scary thing to do. And I had to have support to do that. But finding what really lights you up inside, what you get excited about, what you love to talk about, that is really where you should be spending your time and energy. And then finding people who are making money doing that and asking them to explain to you how they got there, just like we're talking about it. But I started, when you get a nursing degree, you can just go into any healthcare setting and pretty much get a job there, whatever you want to do. It's not hard to get a job, but finding the one that meets your needs and desires is more challenging. And as you move through your career, I ask people to dive deeper into what they want to do and start talking to other people outside of their field or in other areas and asking how did you do that? And it's so easy with social media now. You can follow people and kind of figure out what they're doing and see if they're of influence on you, and then finding out how to do that yourself. But networking, I learned, is a huge thing. And just being yourself, like really showing up as yourself and your true authentic self, keeping in mind the Ignatian spirit, that has gotten me very far in life. Speaking from the Ignatian spirit of service to community and, having an open heart and meeting people, that has served me well. People trust nurses, but Loyola nurses and Loyola students, I would say, definitely come with a good brand image when that's on their resumes, because it is a gathering of people who have the same kind of mindset with social justice and service for the community. And that serves you well. I've learned to really be different than the rest of the crowd. I've learned to use my talents different than the rest of the crowd and stand out, and it has worked for me.
Man, how do I come behind that, Joanne? A lot of great points, a lot of great points you made, including Andrew. Just to tag along on what you were saying, Joanne. Yes, look. There's only one you, right? Be yourself. There's only one you. To be different, you have to be yourself, right? So just to add on to finding somebody that you like, that you admire, right? If it's somebody close that you can actually reach and you can actually talk to them, reach out to them and talk to them, ask them questions, try to find a way to shadow them if they're a trainer or if they're a coach, because that's when you'll know you can get hands-on experience just watching that. And because that's crucial. But the relationships is crucial. Networking is crucial, right? I know, a lot of us is, a little nervous to talk with people, but you have to, right? Because guess what? It's uncomfortable, but that's where growth happens, right? Growth happens when you step outside your comfort zones, right? So, it's just as far as strategy, find somebody that you admire, and guess what? Like Joanne was saying, even on social media, you can ask questions. People like on Instagram, like they're open. If you ask them questions and you're just starting in your career, people are always happy to help, somebody young in their career, right? And people love to talk about themselves, right? Obviously, be nice and kind and stuff like that. But, network relationships are crucial in this, right? Nepotism is a real thing, right? But people go with what they trust, right? I'm not going to just, if I have a bunch of resumes and a bunch of high GPA scores that are similar, I'm going to go with the person that I know, can do the job, that I can trust, right? And sometimes it's that, it's a friend, but, that's what you trust. So I would say that's crucial. Relationships are crucial. Get a routine. Having a routine is crucial because guess what? It's going to suck. You're not going to be good to start, right? But that's where experience comes in, right? So you got to get your reps in. Your hours are not going to be great, right? But that's what comes with it. That's part of you being in your 20s, putting in that work, long nights, to add on to what Joanne, for her to get that schedule, she had to work her butt off to get that schedule, right? She doesn't normally wants to do that, wake up at 6:30 a.m., but she's able to do that now with her own business. But guess what? It doesn't stop, right? The work is always going to be there. For me, I kind of sculpted my own schedule, but after starting a new business as a gym, now I'm literally working 12, 15 hours a day, right? But that's what I signed up for. It's what I love to do. And this is what is going to help the business become successful. So build those relationships, networking, get a routine, ask questions, ask a ton of questions. That's just part of the process, right? And just be yourself, right? There's only one you. To be different, to differentiate yourself in this field, you have to be yourself, right? Only one you. And just, I don't want to talk too much, but I can go on all day, but great information. Thanks, Andrew. Thanks, Joanne. Great information on that stuff.
And I'll quickly just add to be creative. It doesn't matter if your only previous experiences at a summer camp or in retail, you do have applicable skills to the positions that you're applying for. So just be creative about those in the way in which they fit into the role that you're applying to or that you're interested in.
Okay, thank you so much to Dr. Wang, Coach Jermaine, to Joanne, and to Erin. On behalf of NEHOF and Parkinson's and Career Services, we want to thank you all. We want to thank you, students. We have one student who joined us here in the Damon Den, so we want to thank her for being here as well. Feel free, students, just to make sure that look these individuals up on LinkedIn, as they mentioned, or any of their social media channels, and I'm sure that they would love to continue these conversations with you. Many of these organizations are going to be at the career fair on next Wednesday, which is going to be here in Damon from 3 to 6 for Parkinson's, for NEHOF, nursing students. So please feel free. They're putting their information in the chat, so feel free to grab their email addresses, and we'll make sure. So this is being recorded, and we'll make this available, to you all, so that you can go back and grab a lot of these nuggets that they were telling you in terms of strategies and advice. So would like to thank you all for being here, and have a great rest of your day.
Thank you, everyone. Bye.
Bye-bye.
Thank you.
Bye all. Thank you.
Thank you so much.